In this lesson, we will study Chapter 14 Diseases of the Genitourinary System, covering codes N00 through N99. This chapter is extremely important for CPC and CCS exams, especially for chronic kidney disease coding, transplant rules, and sequencing principles. This lesson is for educational purposes only. Please refer to official ICD-10-CM guidelines. Lesson objectives. In this lesson, we will learn how to code chronic kidney disease correctly, understand CKD staging, identify end-stage renal disease, code CKD with kidney transplant status, differentiate transplant status from transplant complications, and apply correct sequencing rules when CKD is present with diabetes and hypertension. We will also focus on common CPC exam traps related to genitourinary coding. Chapter importance. Chapter 14 is frequently tested in CPC and CCS exams. Most exam mistakes happen due to wrong CKD staging, confusion between ESRD and CKD stages, and incorrect transplant coding. Understanding sequencing and documentation rules is critical for scoring well in exams. CKD overview. Chronic kidney disease is coded to category N18. ICD-10-CM classifies CKD based on severity levels called stages. These stages range from stage 1 to stage 5, along with a separate code for end-stage renal disease. Always code CKD strictly based on provider documentation. CKD stages. ICD-10-CM defines CKD stages as follows. Stage 1 is coded as N18.1. Stage 2, which is mild CKD, is coded as N18.2. Stage 3, which is moderate CKD, is coded using N18.30 to N18.32. Stage 4, which is severe CKD, is coded as N18.4. Stage 5 is coded as N18.5. Each stage reflects increasing severity of kidney disease. ESRD coding. End-stage renal disease, also called ESRD, is coded as N18.6. This code is assigned only when the provider clearly documents end-stage renal disease. If both a CKD stage and ESRD are documented in the record, only code N18.6. Do not assign any other CKD stage codes with ESRD. ESRD exam trap. A very common exam mistake is coding both CKD stage and ESRD together. This is incorrect. ESRD always overrides all CKD stage codes. The correct coding is N18.6 only. CKD with kidney transplant. Patients who have undergone kidney transplant may still have chronic kidney disease. This happens because the transplant may not fully restore kidney function. Therefore, the presence of CKD alone does not mean there is a transplant complication. Coding CKD with transplant status. When a patient has CKD in a kidney transplant, assign the appropriate N18 code for the CKD stage. Also assign Z94.0 for kidney transplant status. Both codes must be reported together. Transplant complications. If documentation shows transplant failure, rejection, or other transplant complications, then follow the transplant complication coding guidelines. These cases are coded differently and are not coded as simple CKD with transplant status. If documentation is unclear, always query the provider. CKD with other conditions. Patients with chronic kidney disease often also have diabetes mellitus and hypertension. In such cases, sequencing depends on the tabular list instructions and combination coding rules. Always follow the ICD-10-CM conventions for proper sequencing. CKD with hypertension. When CKD is present with hypertension, follow the hypertensive CKD guidelines. Use combination codes I12 or I13 when applicable. Always assign an additional N18 code to identify the CKD stage. CKD with diabetes. When CKD is present with diabetes, use the appropriate diabetes code from categories E08 to E13. Then assign an additional N18 code to identify the stage of CKD. Sequencing is based on the tabular list instructions. Documentation rule. CKD coding must always be based on provider documentation. This includes CKD stage, ESRD status, transplant status, and transplant complications. If documentation is unclear or conflicting, the provider must be queried before coding. Common exam traps. Common exam traps in Chapter 14 include coding CKD stage with ESRD, missing the transplant status code, treating CKD as a transplant complication, using the wrong CKD stage, and incorrect sequencing with hypertension or diabetes. Quick exam recall. Remember these key rules. N18 codes represent CKD staging. ESRD is always coded as N18.6 only. CKD with transplant requires N18 plus Z94.0. CKD alone is not a transplant complication. Always follow the tabular list for sequencing. Lesson summary. In this lesson, we covered chronic kidney disease staging, ESRD coding, CKD with kidney transplant, differentiation between transplant status and complications, and CKD coding with diabetes and hypertension. These concepts are critical for CPC and CCS exam success.